Hi, Dr. Pelto here. I want to explain a little bit about orthotics. And I got this question the other day from a patient. They said, should I have a rigid or a cushioned orthotic? So first of all, let's talk about, there are different types of orthotics. There are certain orthotics that a doctor can make. There are other orthotics that you can buy over the counter. The main difference in the ones over the counter, they're getting better and better. Okay, the one that I recommend, if you wanted to try, like, what do you recommend over the counter, doctor? It's called a Walk Hero orthotic or over-the-counter insert. It's my favorite. It costs about $20 on Amazon. And I'll put a little link underneath this video of that Walk Hero insert if you wanted to try that. What I'm talking more now about are custom. Why? Well, over-the-counter people try them. I would do more of a rigid orthotic that's going to actually give you more support than something that's a cushion. These gel ones, they're all more for show. They're not really doing that much for you. In my opinion, I like more of a structural orthotic, and let me explain the reason behind it. This example on the left here, this is a custom orthotic similar to the one I do in the office. It has a carbon fiber shell, and it has a nice cushiony top cover. And for a couple of reasons, this won't bottom out when you push on it. If you push on it and it bottoms out, it's not going to be very good for you. This type of a device is going to last, I would say, 3 to 5 years, maybe longer. This other device on the right is more of an accommodative orthotic, we call. It's an orthotic that's made for people that have bony prominences, like prominent metatarsal heads, calluses, maybe diabetes, things like that. It's going to be more a cushiony orthotic, and it's going to give you more cushion and reduce friction on the foot. That's the main difference. I use mostly custom orthotics unless someone is a diabetic, maybe with a history of an ulcer or a callus that looks like it could become an ulcer. That's the main difference. Now, with orthotics, you need to think about it. Your foot is a 3D structure, okay? And it's impacting on a two-dimensional surface, which is the ground. And many times there's different areas that have higher pressure. Most commonly, increased pressure to the heel, and increased pressure to the forefoot, and increased stress that's going through the foot. It's the reaction. So every action has an equal and opposite reaction. So if you put your foot down, the stress from the ground is then going to push back up. That's basic physics. What we use an orthotic for isn't so much of an arch support. We use it to stabilize the heel and reduce the strain going through the foot. Now, my patients always ask me, there's usually 3 main questions that people ask me about orthotics. How long do they last? I say they last 3 to 5 years. Occasionally, we have to put a new top cover on them. Okay. They ask me, how long do they take to make? So the process of making orthotics, it takes about 3 to 4 weeks for a custom device. If you are going to a place and they're saying that they're giving you a custom device and they're giving you that day, unless they're having a 3D printer print it out, it's not usually custom. Custom orthotics still take a little bit. I think in the future, we're going to be able to scan the orthotics and print them out. But at this point, we're in my office anyway, we're not doing that. So that takes about 3 to 4 weeks. And the last question is, how much do they cost? There's different prices for orthotics. They are going to be substantially more expensive than an over-the-counter device. So an over-the-counter, you're looking 20 to 50. You shouldn't have to pay more than 50 for a really good over-the-counter device. They last about 3 months, 3 to 6 months. So in the long term, if you're switching them out every 3 months or so, a custom orthotic is going to be more. Our orthotics are usually between 550 and around there. That's about what we charge. You may be wondering, well, why don't insurance cover them? Well, I find insurance tends to cover less and less, but they are very effective for helping people and their condition. So if you have orthotics, that's great. You know the benefit of them. And I would say we can guarantee the comfort, meaning they're going to be comfortable for you. I can't guarantee they're going to take away all the problems because it's usually caused by multiple factors. So if you listen to any of my lectures about plantar fasciitis and things like that, it's not just we're reducing the stress and strain, but we also have to reduce the pain and loosen the tightness and things in your body. So once again, if you guys found this beneficial, let me know. I'm going to put some other videos, one of my videos on plantar fasciitis that's going to talk about how I treat plantar fasciitis here. And if you have any other questions about orthotics, let me know. This other orthotic is a cushiony one. I explained I don't do those as often, but they can be useful if you have diabetes. Okay, thanks guys.